Hi, I'm Kareem Salhiya, consultant cardiac surgeon. How do we prepare a patient for open heart surgery? Once the patient is being diagnosed with having a heart condition that requires a surgical intervention, the patient must undergo a series of steps to make sure that the patient is ready and safe to have open heart surgery with the best outcome. At the beginning, we start by reviewing the patient's investigation and confirming the actual need for surgery. We look at the patient's actual investigations, such as the actual angiogram or cardiac catheterization CD, the actual echocardiogram pictures, and not just the reports. So therefore, we encourage the patients to keep the actual investigations available with them. Then we proceed to have a thorough assessment of the patient by taking a patient history and do a physical examination. It is important to look at the patient medications and check if there's any medication that requires special attention. Some of the medication must be stopped before heart surgery, such as blood thinners, and some other medications require special attention after the operation. It is important for the patient to mention any allergies, either to food or substances or drugs. So therefore, we have to take extra care for avoiding these medications or substances throughout the operation. Then we proceed to performing some investigation. We start by blood tests. We perform a full blood count. We look at the kidney function and the liver function. We do some tests for the diabetes and the blood cholesterol and any other blood test that is required for that particular condition. Then we proceed to performing some investigation, and we start by performing blood tests. We do blood tests to check for the blood count and for the kidney function, the liver function, the cholesterol, diabetes, and any other test that we think is required for that particular patient condition. Then we do assessment of the breathing capacities by performing a breathing test and performing a chest X-ray. In some patients, we do require an ultrasound scan of the neck arteries to make sure they're free from disease, and some other patients might require a full CT scan to look at all the arteries of the body. And sometimes we do another MRI scan of the heart. We advise everybody to get a swab from the nose to check for the presence of any resistant bacteria, and we also check these days for COVID-19 or coronavirus infection before the operation. I am a strong believer of controlling and optimizing pre-existing risk factors and health condition before the operation. From our experience and also from many studies and trials, this was shown to be an important factor in improving short and long-term outcomes. Such risk factors include control of diabetes, high blood pressure, anemia or poor blood levels, stopping smoking as much as possible, and also improving the respiratory function and the breathing conditions for people who suffer from chronic breathing problems. Once we have finished all these tests, we discuss with the patient again the indication for surgery, the benefits, and the risks. We also discuss what would happen if the patient decided not to undergo the operation. The patient then will be given an antiseptic solution to wash for. This will reduce the incidence of infection post-operatively. Blood and blood products will be prepared the day before surgery, and sometimes patients have to donate blood before surgery. The patient will be given an antiseptic solution to bath and shower with. This will reduce the incidence of infections after the operation. Blood will be prepared the day before the operation from the blood bank. Usually, patients get admitted to the hospital the night before surgery. This gives them a time to relax and adapt and take their time. However, sometimes we do admit patients on the same day if all the tests have been done. The patients usually get admitted to the hospital the night before surgery. This gives them time to adapt and relax. Sometimes we do admit patients on the same day of surgery if all the investigations have been done. Once the patient gets admitted, they get shaved and they're usually kept without anything to eat or drink 6 to 8 hours before surgery, usually from midnight. Sometimes we have to put some intravenous fluids or give special medications such as insulin before surgery. The anaesthetist can give what's called pre-medication, which is some drugs to help the patient sleep and relax before surgery. In the morning of the operation, we advise the patient to have another shower with the antiseptic solution that he or she was given. Heart surgery has become a very safe and effective treatment for many heart conditions. It improves patient survival and quality of life. We do advise patients not to delay the surgical treatment and to undergo through the process of preoperative workup. It is very important to have good preoperative optimization of the risk factors and to follow their instructions, because this is one of the most important factors to have best outcome on the short and long-term outcome. We have found that positive attitude and good spirits and morals are one of the best predictors for success. And it is very important for patients to have this state of mind before undergoing surgery, because this will help them to get through as much as possible. And we wish everybody health and well-being.